Welcome back. Stem cell therapy is talked about all of the time, often described as anti-aging or regenerative treatments. Clinicians believe that stem cell therapy is a game changer in modern medicine. Joining us now is cardiologist and scientist Dr. Ernst von Schwarz. He's a leader in stem cell therapies for chronic diseases and author of The Secret World of Stem Cell Therapy. It will be published next spring. Good to see you again. Thank you so much for joining us.
Good morning, Elise. Thank you for having me on.
This is very exciting. I'm all about anti-aging, and I think a lot of people are as well. So what are stem cells, and how does stem cell therapy work in the body?
Well, stem cells are basically the engines, if you wish, in our body. It's those units which make us what we are. In the embryonic state, basically, stem cells are pluripotent, meaning they can develop into any tissue in the body. So stem cells develop into our eyes, into our skin cells, into our heart, and into our brain cells. So everything which we are in our body stems originally from a single stem cell, and they divide and they become specialized, basically specialized cells and specialized organs.
And which medical conditions are most likely to benefit from stem cell therapy in the future? A lot of people want to know about that.
Probably all, actually, because there's a paradigm shift in medicine from what we call reactive medicine, meaning we treat symptoms and injuries after they happen, to what we call regenerative medicine. So this is the biggest advance in modern medicine, that we shift basically to repair. So stem cells are supposed to repair whatever is damaged. And from my own experience in research projects, in particular vascular conditions, whether it's coronary artery disease, heart failure, strokes, Alzheimer's, sexual dysfunction, you name it. But other conditions also, many orthopedic colleagues use stem cells already, even though it's not FDA approved, to repair joint damages, muscle damages, tendon damages, among many other conditions. Even diabetes and other diseases are possible targets for stem cell therapy.
Okay, well, what do the latest studies show about the effectiveness of stem cell therapy in treating medical conditions?
Well, if you look in the literature, basically every single study which was ever published using stem cells for you name whatever condition is this, let's say heart attacks or heart failure, have shown benefits, no doubt.
And so can you talk about some of the common off-label uses for stem cell therapy that may have been performed by physicians?
Well, as I said, at the current time, there's no FDA approval for any stem cell therapy, so it's all done within clinical trials. Besides, of course, some people try to sell therapies off-label. It's mainly used right now for facial injections, for example, for so-called anti-aging purposes. And a lot of orthopedic guys use it for damages in the joints, especially knees or hips or chronic back pains, because it works because of anti-inflammatory and angiogenetic properties, so patients do much better afterwards.
And do you think the FDA will approve this anytime soon, or do we have to wait a while?
I think we have to wait a while, because what is lacking is large-scale clinical trial data, especially placebo-controlled studies where we compare to saline injections, for example. It looks very, very promising for all of us, but again, the FDA will take its time for the safety of all of us.
All right, Dr. von Schwarz, thank you so much for joining us. Very interesting. We appreciate it.
Thank you for having me on.